I hope you're having a great day. Today, I want to talk about a lot of you wrote into me talking about, Luke, you speak about handling the side effects of medication. In integrative and lifestyle medicine, which is my practice, it's extremely important for us to understand the importance of medication for your condition. We are not alternative medicine, we are integrative medicine. As I speak to you, my patients are going through chemo, radiation, some of them are on steroids. Some of them are on antibiotics. Medication can save your life. At the same time, if we misuse medication or we don't need it, or we're not following the prescriptions of our doctors, or we just think we should self-medicate ourselves, that's when we have a lot of issues. Every medicine that you take has a side effect. Every single drug that you take. In integrative and lifestyle medicine, while our job is to maintain and manage and enhance the immune system of the patient, keep inflammation low, our job is also to manage the side effects of the medication that the patient is on. If you are only getting treated for your condition, taking the medications without changing your lifestyle, without understanding how these medications deplete certain vitamins and minerals in your body, while you may get sorted out with the primary issue, you create secondary issues. Look around in our country and around the world. The biggest problem is chronic sickness. People are on multiple drugs for multiple conditions. They never really get better because they're not managing the side effects of the first drug, which now causes new conditions in the body. And then they have the second drug. They're not managing the side effects of the first and the second drug. Now they have more problems in their body caused by the depletion of vitamins, minerals, or other side effects of the medication. So whenever you're on a medication, you need to understand that you've got to manage the collateral side effects of every medication. Today, we're going to talk about antibiotics, because that's what a lot of you have written into me asking me to explain. Antibiotics can save your life, but they do not come without side effects. If you gotta take it, you gotta take it. I know many people who were prescribed antibiotics, but they didn't take it. And those bacterial infections grew more and more. Some of them were fatal, and some of them had the patient hospitalized in the ICU for further treatment. Bacteria, not treated, can create havoc in the body at a cellular level. So sometimes, light bacterial infections, your doctor may just say, hey, rest it out, eat some good food. But severe ones, you may require an antibiotic. So it's extremely important for you to make the right decision under your doctor's supervision. Now, when you consume an antibiotic, like the word says, an antibiotic's job is to basically kill bacteria in your body. Now, an antibiotic doesn't know how to differentiate between the good bacteria and the bad bacteria. So what it does, it's called a broad spectrum antibiotic. It goes and it kills most of the bacteria in the hope that it's also killing the bacteria that is causing your problem, that is causing your illness, that is causing your fever, that is causing your stomach pain, whatever condition it is. So while it's cleaning out in its honest attempt and it's killing the bad bacteria, it is also killing your good bacteria. Now that's where the problem is. If it's killing your good bacteria, what is the function of your good bacteria? Regulation of your hormones, your neurotransmitters, your immune system, your skin, your hair, your vital organs, and everything. So your gut gets affected. Your microbiome in your gut is a colony of trillions and trillions of different cells and fungi and bacterias and even stored viruses. And all of them work perfectly until the ecology in your microbiome starts to change. So let's say I have good bacteria and I have bad bacteria. If the good bacteria is more than the bad bacteria, everything is good. If the bad bacteria is more than the good bacteria, we have a lot of problems, from your normal nausea to bloating to acidity to constipation or IBS-like symptoms, inflammation, headaches, candidas, yeast infections, and so many other things. If you become resistant to an antibiotic, it can be absolutely dangerous for you, because when you really need it and the antibiotic doesn't work, you could get very, very sick, and it can also be fatal. So it's important for you to understand that you take your prescription drugs from your doctors and you don't try to self-medicate. Another tip is, if you've given a 5-day course, but let's say you started it, and on day 2 you feel absolutely healthy, do not stop the antibiotic course. Finish all 5 days. Do not stop it, because sometimes you may feel better, but there are still minute bacteria that need to be killed, and that's why you're on a 5-day course. Now let's say you stopped the antibiotic medication, and a few days later, those bacteria express themselves into a condition again. Now you're going to need a heavier course of antibiotics, which is not good for your gut or for you. So what we need to understand is, how do we prevent the side effects of these antibiotics? What is an antibiotic depleting? Every drug depletes something from your body. So if I'm managing the side effects of the medication, I need to understand how the drug is working in my system, what it's depleting, so I can put it back into my system through food or supplementation. Deplete vitamin K. Now, vitamin K is produced by the gut bacteria. If your gut bacteria is affected by our antibiotics, you drop your levels of vitamin K, which is not really a good thing for your bones, for the regulation of your calcium, for the coagulation of your blood. Your B vitamins get depleted as well. Your thiamine, your vitamin B12, your folates, because this also, a healthy microbiome when compromised by antibiotics will reduce the absorption of nutrients. So you will have to be on a B complex or eat foods which are rich in B vitamins. Probiotics are extremely important because that's what's going to help you. Your prebiotics will feed your probiotics, which will help you populate good bacteria in your gut, especially when the antibiotic is killing most of your good bacteria and the bad bacteria as well. Your prebiotics will be non-digestible fibers that you find in things like garlic, onions, leeks, asparagus, banana, especially green banana. All of these are very powerful prebiotics for you. Now, you can talk about foods like vitamin K rich foods will be your green leafy vegetables, your fermented foods, your broccoli, your cabbage. These are great foods for you. Okay, you don't want to do it in a raw form. You want to do it lightly blanched, lightly steamed, or lightly cooked. Your B vitamins will be found in meat, fish, eggs, your dairy sources, your legumes, all of your bean family, and your whole grains. Your magnesium will be found in nuts, seeds, whole grains, green leafies, and your beans as well. And your zinc-rich foods will be meat, shellfish, legumes for the vegetarian, seeds, nuts, dairy, and whole grains. During the time you're on antibiotics and for at least a week after, no sugar and no refined carbohydrates. Because sugar and refined carbohydrates feed the bad bacteria. So one way of killing bad bacteria in your gut is by starving it from sugar and refined and highly processed foods. When you're on an antibiotic, you want to avoid taking it along with dairy products and calcium, because certain antibiotics will bind with calcium, reducing the efficacy of your antibiotic. You want to avoid taking it with coffee. You want to keep a gap between your coffee, at least a 2-hour gap. It's extremely important to understand antibiotics are powerful drugs. And then a week after you finish the antibiotic, I would stop with all the supplements as well and then move on to these foods, which I should also be eating anyway because they're extremely healthy foods. So make a note of all of these things, implement it in your families, teach it to everyone around, and do not abuse antibiotics. But when you need it, you will need it. Have a great day, everyone, and peace be with all of you.